Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. I will. Okay, well, it's interesting when we talk with Dr. Mencia. Some weeks he comes alone, and some weeks he doesn't come alone. And this week, he came with a very charming person. She was afraid she was too captivating for the radio. I said, no. We have great guests, or we don't allow them to come if they're not captivating. I
found a radio star.
Right. Now, Debbie, I don't know your last name.
My last name's Korman.
Debbie Korman,
yes.
And she has the greatest company's name. I don't know how your company is, and Dr. Mencia must love it or he wouldn't have you here, but Senior Spot.
It's called the Senior Spot. My he's 27. My 27-year-old nephew thought of it, completely changed my mind with what I was going to pick, and it stuck. I liked it, and we put it up on the wall, and that was it. It's done.
And what do they do at Senior Spot? So, Dr. Mencia, wait, let me go back. How did you find Debbie, and why do you like this?
Well, Debbie been on the healthcare arena for some years.
Yes.
And, just like you and I, you as a gerontologist, me as a geriatrician, and she had been involved with geriatric care. And she came up with the idea of creating a adult daycare center with a little twist to it. And I like the fact of the dignity, trying to treat the residents, the guests, the clients with dignity and individual care, meeting their individual needs. So I say, you're a great person to come to the show and talk about this because it's something different.
Okay, so what made you do this, Debbie?
Well, I was about 12 years. I was working as an administrator for an assisted living in Davie. It wasn't stimulating enough. I didn't love it, and I needed to get out on my own. And I thought of this, and I called a nurse, and she said, do it in Fort Lauderdale. It's a much-needed service there. They don't have anything. So that's what I did. I moved to Fort Lauderdale. I opened it up. Took me almost 2 years to get a license and all the right paperwork. And we're finally open. It's about a month. And now we're just waiting for the people to come in.
Okay, well, what would a person expect when they come?
Well, it's a full day of activity. So, you start the day with chair exercises. You move to word games. You do lunch. You do 2 snacks. We're going to do arts and crafts. We're going to do old songs because that's all they remember. And we're going to do, I think, I Love Lucy episodes. I'm going to see how that works. I'm not really sure, but I have that ready to go. And that's it. We're going to give them a full day of activity. We're going to tire them out. And by the time they get home, we hope that they'll be a little more tired. They'll sleep better because a lot of people are having issues with sleep. And I guess they'll just have dinner and go quietly to bed. And that's pretty much it.
Well, Dr. Mencia and I have discussed this before, and he always tries to make his patients happy, even though they come for medical purposes. And he has always said that sitting home alone is not happy.
Right.
And he always tries to get them to go out, but you have to be careful when you go out. You need to be in a place that's safe and secure. And so I think that's why you thought this is a good idea.
Yeah, us as society, we're still way behind with regards to adult daycare and adult needs as we age. And our society now compared to some years back, some years back you can take your 11-year-old daughter or son to take care of your 9-month-old son or daughter, and they would leave them alone at home, and that was okay. And today we say, no, that's child neglect, child abuse. When it comes to the geriatric population, we think it's okay to leave the geriatric patient home alone, knowing that they are demented, knowing that they can turn on the stove and forget it on, burn the house down. And if you have insurance, it will get paid for. But the point that we are missing as a society is that we cannot leave our loved one home alone. And sometimes it's the daughter-in-law or the son-in-law taking care of the elderly person. And they might not have that family connection like your own son or your own daughter. So we still have a lot to learn.
We take very good care of our pets. We take our pets to daycare if we're not home. And so you're absolutely right. And I don't even want to go to people who are demented. I want to go before that. There are people, they just don't have friends. They've lost a spouse. And they're sitting at home. And so people who are listening here, you don't have to be...
And they're being over-medicated.
Yeah, well, even...
Because they are depressed, because they are home alone. So they get over-medicated. Okay, let me treat you for the depression. And they are not getting up to eat, so they are malnourished. Mm-hmm. So they start giving you appetite stimulant and start giving you all kind of medication. And that's why you see so many elderly patients, Anita, with 20 medication a day. 20 different medication. That's too much. The liver will explode.
So here comes Debbie. And
Right.
Debbie has... No, seriously, this is... This is the great idea that people can... And we're going to get to where you're located and tell everybody. But
Okay.
So now a person can, let's say the adult children can feel so much better. They're working, but they know that their loved one is at a fun place. I mean, then when they get home, they're going to have so much to talk to them about. They're going to be safe and secure, and beware, there will be romances. I know that.
Yes, they do. They hook up together. They might be married couples. It doesn't really matter. They might be with other people. That doesn't matter. And it happens all the time. But it's just a very simple relationship. Nothing ever goes beyond the simplicity of it.
So what we should do is say where you're located.
We're located at 410 East Oakland Park Boulevard. We're in Wilton Manors. We're just west of Dixie Highway.
You're right next to the spa.
We are
a little bit
east.
Close, probably another couple of miles.
Next to his place.
His new,
I don't know.
He has a beautiful new spa.
By Bayview, on Bayview and Oakland.
Yeah, okay,
The Stonewater
It's close
Med
enough. Yeah,
Spa.
it's
not far from that.
Yeah, it's close to Dixie Highway. So
right. But it's on Oakland Park
It's
Boulevard,
on Oakland
right?
Park Boulevard also. Yeah.
Okay, so and what's the phone number if someone wants information?
305-988-0368. That's my personal number, and it's
good.
the best number to reach me.
Now, someone could be dropped off how early?
7 a.m. And we're
Okay.
open 6 days a week, and I've actually considered opening up the 7th day.
All right, 6 a.m. till how long?
7 a.m. until 6 p.m.
7 to 6.
Yes.
And that, just think about this, Dr. Mencia, and of course, Ina is here sitting quietly. But I just want to say that think about the people who love their parents or parent, and they're so frustrated, they don't know what to do. They have to go to work, but they don't want to leave them at home, and they don't know what to do really with them. They bring people into the home to be with them. And that's
also,
not the same.
I also had somebody yesterday who came in. This is a big issue, the separation between spouses. So the guilt. So let's say a husband or a wife comes down with dementia. The spouse has an issue letting them go to an adult daycare. So they will assume the total responsibility of full care, and they cannot do it. What happens is they end up going before the sick person does. The stress level is just too high. The best thing for a case like this, which is very common, put them in an adult daycare, let the husband or wife get stimulation, be entertained. The husband or wife should go about their business, relax, do their things, watch TV. I mean, it doesn't matter what they do, but they need to separate. And this will save the health of both the partners. So not only the dementia patient, but also the caregiver.
It's a very good point.
Right. Yeah,
very
in
good
geriatric,
point, isn't it?
in geriatric, we call that the caregiver stress syndrome.
Yes.
It's very common. It's a very common syndrome, and the caregiver end up being depressed also.
Yes.
And suffering through anxiety and taking medications very early on the game because they are being overwhelmed with the care of their loved one.
Yes, I think it's way too big a project for them. I think they don't know what they're getting into. I think it's very difficult for them to handle it. and they need help, and they need their families to get involved and to sort of convince them that they need to do something with their spouse instead of leaving her home to be cared for him.
And if you live close to the daycare,
yes,
and I take my loved one there to be under your service, can I come like at lunchtime and sit down with my
but it's not a great idea, but yes, you can.
So I don't feel like guilty.
Yes, you can from the guilt, right? But eventually, and this we saw a lot of this in the assisted living. There was a tremendous amount of guilt, but eventually that guilt dissipates.
Oh no, absolutely.
Right,
but
so
at the beginning,
it's
a way of trying to release that guilt.
And then the other thing that happens, they don't even want to see you. Leave me alone.
Yeah.
I'm having too much fun. Go wherever.
Yeah. and also the relationship starts.
Right.
So
they're having fun, and they're having relationships with other women. Maybe they haven't had friends.
Yes.
And now they can talk about it. I wanted to just tell you that I once talked to a man. He was a young man, and he had his mother living with him. He was taking care of her, and he had to go to work. And there was a daycare center somewhere up in West Palm Beach, and he would get her there at early in the morning, pick her up at night, and he was able to take care of her, not have to put her into some home somewhere. I thought that was absolutely a wonderful thing.
I have a patient of mine with Parkinson's disease, and it's a Spanish family. So it's, the extended family concept come into play. So like 4 kids live in the place, 5 or 6 grandkids live in the place, like a big family. And my patient go to the adult daycare. And I say, like, wait a second. Like, why would you go there? You have all this family at home. Why are you doing this? Do you really need this? And he said, Dr. Mencia, there's a generation gap. When I go to the adult daycare, I am with people of my generation. So while these kids are playing video game and Nintendo and whatever they play today, I have no one to talk to. When I'm in the daycare spot, I already have friends there. And we look forward to seeing each other every day.
And also, that they live in the past. So although their memory of the present is gone, the past is very clear to them.
Right.
So that's why old music works and old friendships work.
Right.
And people of their generation work. And the young stuff doesn't. So I agree with you.
Okay, so Debbie, why are you doing this? What made you get into this?
What motivated you?
Yeah,
yes.
We always get that. What motivated you?
Well, I worked with assisted living for 12 years. I liked it, but it was time to leave. It was not stimulating enough for me. I wanted to do something that on my own, and I came up with adult daycare. So that's it. The nurse told me where to go. She said Fort Lauderdale's in much need of an adult daycare. So I did it. I scouted and I found a place, and we opened up, and that was it. It took me 2 years.
But it just didn't happen like that. I think you liked older people when you were a little kid.
Well, I do. When you work with the elderly, a lot of people have issues. I don't, and it's a great job. It's a very rewarding job. I happen to love my work, even though I'm not full yet. I do love it, and that's it. I think it's very rewarding.
Well, one thing I do want everyone to know is that Dr. Mencia feels the same way. That's why he is so dedicated to everything he does.
I was going to open an adult daycare in the building next door. I don't know if you recall.
No.
I was going to years back.
Yeah.
We look at the whole structure.
Remember that.
And the only thing that finally ended up stopping us from moving forward was that we had to have a sprinkler system and blah, blah, blah. I said, wait.
Yeah, a lot of things when you have that.
We thought that having something really close to us would have been great.
It would have been perfect. So now you just go down there.
Once the government gets involved, it's crazy now.
Yes.
It's really crazy.
Yeah.
So, even for me, for 2 years to wait, the money that goes into it,
right.
It's very expensive.
Senior spot. I love that. Senior
like
spot
I say,
name.
society is behind with the protection of the geriatric patient.
Well, let's tell everybody Dr. Mencia is going to run off here at 7:30 to go to work because he's open on Saturdays, something unique in the field of medicine. If you want to make an appointment, please call 954-489-1345. Is your Boynton Beach Center open today?
Yes, and the dietitian, Courtney, is going to be seeing patient.
Oh, really? Oh,
right,
fabulous.
on Saturday. So
if you haven't met Courtney, you need to meet her. She is an
so
angel.
dynamic. Yeah.
She is wonderful.
A dynamic angel.
Dynamic angel, right. The number over there is 561-270-6494 if you need home visits. And that's really important that Dr. Mencia jumped out into this field. Not many doctors, if any, do this with the way they do it. Please do ask about for homebound patients, and Medicare and most major insurances are accepted for what they do. Also, I don't want to forget about the Stonewater Med Spa. And I just want to ask Ina, tell me what's going on there.
Good morning, everyone. Everything is good. This coming Sunday, this Sunday, we are having an open house.
Oh, good. Good to
Yes.
know. Open house. Hello.
Tell me about this.
Go ahead.
Open
So
house,
it's-
what's
Keeping it all to yourself. Yeah.
Yeah, what is this? Open house when?
This
Sunday?
coming Sunday,
Not
tomorrow.
Tomorrow?
Tomorrow.
What's
And
up?
it's from
tomorrow.
12 to 3.
Oh my goodness.
And we will be
good.
having Dr. Raskin there presenting the new procedure that she will be doing.
Oh my goodness, you didn't even tell me. You want to
Dr. Ruskin. I know, right?
You
Dr.
know
Ruskin.
what they
You
say
met
is
Dr.
better
Ruskin
later
there.
than never.
later than never.
And they're going to be some others. And
Yes, and we're gonna also have a couple more people that will be providing new services to the spa. Like we'll be doing lashes and all of that.
so that would
Laser
be
hair
Lashes are
removal.
gorgeous. So those
Yes.
are real though. No.
No, they're not.
No,
Oh,
They're
you
fake.
that,
No,
I put
they're
them
not.
on.
No, you put me out there with
Your
so
lashes
everybody
are
can
so
know.
They're beautiful,
gorgeous.
but they're still
Always have
beautiful.
lashes.
Yeah,
Are you going to be
Thank
there,
you.
Dr. Mencia?
of course, tomorrow.
Okay. I
And,
am there. Can I bring
yeah.
my dog?
You can bring your dog. Just
Yes.
for the audience, the listeners, please make sure you call and make reservations
RSVP,
so that they
yes.
know, so you know that you are coming. Because if we need to do another event with Dr. Raskin, then we will promote it.
Okay, let me give the phone.
Yeah.
Sorry. Let me give the phone number. It's 561. I'm sorry. It's 954-561-8799. If you're going to come, make a reservation.
Excellent.
Is that it?
Yes.
That's yes.
Very
For now,
good.
that's it.
now you are not keeping it no longer
forget
to
it.
yourself.
Oh, now I'll go back to
Now you
senior
like to
spa.
go to the movies?
I love the movies.
There is a movie that came out.
Okay, what?
You know, they have the Jewish genocide,
It's called
The Promise,
I heard this.
the Armenian
Promise.
genocide. And you know how people have been opposed of the Armenian genocide to come up in the air and it been blocked. They had tried in the past to bring out awareness about the Armenian genocide, and it had been blocked by groups of other interests. Finally, the movie did come out. It's an excellent movie. I encourage you and people that
Promise.
that you know that don't know about the Jewish suffering and their past, and the Armenian suffering and their past, to go and see this movie.
Okay.
It's so well made.
We'll do
It's
this.
excellent. It's all over. It's open nationwide.
So maybe I should do a little review of it or something.
That would
let
be
me
nice,
think
yeah.
about it, because you think
Yeah.
whatever you think, I always do. I'm your
Yeah.
best patient. All right, let's. I am. Well, no,
I'm my best friend.
Yeah, I mean, I believe in him so much. Okay, so let's go back to you, Debbie, because I want to just know. So let's make believe that I come in.
Yes.
I come in and I'm someone, and whether I have some any issues with forgetting or something, or just because I want to go to a nice place. What's the first thing I'm going to get? Breakfast? Tell me what happens.
Well, it's kind of a breakfast. It's something light. We're going to serve coffee, of course, and juice. I don't think they're big coffee drinkers. You probably have to put half water, half coffee in there. We'll probably
Bagel?
give maybe a bagel, but I
Okay.
think a bagel might be too hard, even because they have dentures, and you have to consider things like that.
we
Then
don't
you
talk
send it
about
to me, so we
dentures,
do
right?
implants. We do dental
Oh, you
implants.
do. So perfect.
So they can have your bagel.
No more dentures.
Or maybe like a muffin,
okay,
something
muffin's
like
good.
that.
Muffin
Okay,
is cool.
muffins are good.
So then we're going to serve a hot lunch. We're going to have 2 snacks during the day. And that's it. They'll be plenty fed. We don't
And
have to
let's
worry.
say that I have some incontinence. Are you going to
Yes.
help me with
Yes,
that also?
Absolutely. There's CNAs on staff. The ratio, it's very, very, I don't know, high or low. I don't know exactly the term to use, but it's 1 per 6.
That's fabulous.
In assisted living, it's 1 per 35, I think.
1 per 6 is
So
great.
it's really
Yeah.
unbelievable. So you do have assistance with diapering, with changes, things like that. We expect that. So far I've had 2 customers. I haven't had issues with it, but definitely no problem with diaper changing.
Okay, so now who's going to do the exercises? Because I know you'll have that.
I'm going to have an activity director, and she will do everything. So we already picked the exercise video. It took us a long time to find one that was long enough and easy enough for seniors, but we found one, and so she'll do everything. And we're going to have to find somebody who's artistic and able to do arts and crafts and keep them motivated.
Well, this is sensational, and I wish you so much
Thank
good
you.
fortune with this because it's very needed. And maybe 2 years from now, you'll be telling me about the others you just opened.
Yeah, I'm already thinking about it.
Good. And remember this for people that live in the east side of Broward County and people that have to go to work. Sometimes you have to drive all the way west to drop your loved one and then go back on 95 to go to work. Now you have something really close for people that live on the east side.
Good point.
And also there's a service called TOPS. So TOPS is a busing service run by the Broward County. It's less than $8 return, and it's a very simple, it takes 2 to 3 weeks to set it up, but it's a very useful tool. It'll pick up your loved one, drop them off, and then pick them back up and drop them back home.
Oh, that's excellent. They can call you and you can help them with it.
Yes, and I can help them.
Let me tell everyone the phone number again. It's 305-988-0368.
Yes.
305-988-0368. Open 7 a.m. to 6 p.m., 6 days a week, and it's called Senior Spot.
Yes.
Well, Dr. Mencia, as usual, you always bring these great guests that tell a lot of things.
Wonderful world of wellness. It's all about wellness.
Wonderful world of wellness, because I know that you do believe that it isn't just a senior, it's another person inside there. We always say the seniors, but that's a person like we were when we were a kid. I mean, that's a human being just because they have white hair or because maybe they're...
And it's a very
we
neglected...
gotta respect that.
It's a very neglected population. I'm sure Dr.
In the
Mencia,
society, yes.
Dr. Mencia knows
And
that.
I spent many, many years as a geriatrician personally taking care of patients in the nursing home. And I've been on the ALF like you have, and the rehab center like you have, Anita. And if we all work together as a community, we can keep the patient at home. And this is the objective we should strive for, keeping the patient at home.
Yes, because the care in an assisted living and in a nursing home is really below par. It's not good enough. And that's why you need to keep them out and try and keep them at home. Yes, I agree.
And that really, what you're talking about, the family, we miss those big families because that really was important to the senior adult. And now we have to have something to make up for it. Now, the government did do senior centers, and there are senior centers, but it's different. You have to be a lot more independent. You have to be able to get there, and then no one's really doing the same thing that you're doing. So I want people to know the difference. You may go to a senior center, and that's good. We have a lot of them here. But this is a lot more individual. This is a senior spot. That's why I like that name. Mm-hmm. You're going to go to a spot that's going to know who you are.
Yes.
When you come in, you're not just someone walking in. You're Mary Jones.
Yes.
And we got something from you that we heard you talk about last time. It's very personal. That's personal service.
We're very excited about it. It's a new venture for me. I'm excited about it. I'm happy to do it. And we hope it works. That's it.
It's gonna work.
We hope so.
It's gonna work.
So
We
you're
hope
going to
so.
now invest your entire life.
Yeah,
with
you're leading the path. It's gonna work.
Yeah,
and you're
thank
gonna
you.
create a
There's
new.
so many prospective patients, out there that need the service. So we're hopeful.
Well, I think just from Dr. Mencia putting his little hand on your head and saying, you're going to do well, but he knows that how valuable this will be. And something you brought up, being at 410 East Oakland Park Boulevard, it is way east in Fort Lauderdale, and there aren't a lot of things in that way.
There's no, right.
And everything is because of the
A
residential.
lot of the adult
all
daycare,
west,
they are
right.
out west.
Yes.
So this is great to have something like this.
Right. Okay. Well, we're certainly glad that you came here.
Thank you very
we
much
wish
for having
you a
me.
lot
Thank
of luck,
you.
and I'm going the way. Let's not forget about tomorrow. I'm going to do that tomorrow from 12 to 3, Sunday open house. Dr. Roskin's going to be there, and at Stonewater Med Spa. And of course, Ina's going to be there with bells on and her lashes.
Bells and whistle.
Her lashes.
Yeah.
954-561-8799. Make a reservation. I'm coming. I don't know what time, but I definitely am going to come over there. So thank you all for being here. This was great.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.